What from your experience has cosmetic surgery done with people with body dysmorphic disorder when they go and have surgery? Does it help them? Does it alleviate their problems, or does it kick the can down the road?
No, it's not a good idea. It's really a bad idea because, most people with body dysmorphic disorder do get cosmetic procedures of one sort or another. Dermatologic treatment is most common because skin and hair concerns are the two most common concerns of body areas
Okay.
that are most often disliked. But surgery, yeah, about 25% get surgery, often a nose job, rhinoplasty, other kinds of cosmetic treatments. And as best we know, the good studies that have been done on this indicate that it almost never improves the body image concerns overall. So when I say overall, sometimes, maybe 20% of the time, people with body dysmorphic disorder who have a cosmetic procedure, think that the treated body part looks somewhat better. It's maybe 20%, only 20% of the time. But overall, BDD gets better only about less than 5% of the time. So why is there that discrepancy? I think it's because most people with BDD worry about more than one body part. So if you get one body part cosmeticized, if you get some cosmetic procedure, you still have all these other concerns, right, that still bother you. Or in about maybe 40% of people, they get a cosmetic procedure. Okay, they think that's all right. And then they switch to a new body part. They develop a new concern. And this makes sense because the problem in body dysmorphic disorder is not with how people actually look. It's with how they see themselves. It's their body image. It's distorted perception of how they look. And so if you change a surface characteristic, right, you put in a chin implant, that changes actual appearance, but it doesn't change body image. They tend to still be obsessed with minor or non-existent flaws in how they look and to obsess and worry about it. So it's not a good solution. And sometimes people get much worse after they have a cosmetic procedure. I have recently seen a number of people with body dysmorphic disorder who got very suicidal after a cosmetic procedure because they thought, it ruined how they look. Well, they still look fine. There's nothing wrong with how they look, but it's their perception that the cosmetic procedure made them look even worse. And again, their perception is inaccurate, right? Their brain is too good at seeing detail, and they have trouble recognizing that itty-bitty things are really just tiny. They're not huge and prominent and something that other people would notice. So we don't recommend cosmetic procedures because I always, everything we know suggests that they don't help people with body dysmorphic disorder and can actually make it worse. I've seen so many people I've had so many patients say to me, tell everyone, if you have body dysmorphic disorder, don't get surgery. Don't get a cosmetic procedure. It ruined my life. The usual outcome is no change. So the usual outcome is not horrible. It can be. But usually it's no change in their obsessions with how they look. But that's not a positive outcome. If you've spent a lot of money, maybe you've had downtime to recover, maybe it's been painful, that's a disappointing outcome. So almost no one with BDD feels, better overall in terms of how they look.
I guess they just change. They're just shifting the crosshairs,
Often.
aren't they?
They often shift to something else, or they're still worried about other things, or, sometimes people are satisfied temporarily, and then over time, they don't like what was done. They see a little asymmetry. They notice something that wasn't, in their eyes, perfect about the surgery. It's not exactly what they had hoped for or wanted, and they can start getting obsessed again with that same body area.
Can they shift those crosshairs, or do you find that they shift those crosshairs to someone else? So in relationships, that they then start to look for other people. So I kind of think of the person who has the nose job and then looks at their partner's nose and goes, "Oh, you could kind of get that too." So do people with BDDs tend to start to outwardly express it to other people?
Well, there is there's a form of body dysmorphic disorder called body dysmorphic disorder by proxy. Proxy referring to somebody else. I'm not sure how often it happens after they've had a cosmetic procedure that they don't like themselves, but yes, it can focus on other people, perceived flaws that the person perceives in other people's appearance. A partner, yeah, maybe a wife, fiance, girlfriend, boyfriend, a child, and it can be so disruptive to the relationship. And I have seen, young men who were engaged to be married, and then they said, "I don't know if I can go through with this because, my girlfriend's hairline is receding, and, she looks terrible. When I look at her, it's all I can see." And it can be so disruptive to relationships. And, we've been able to successfully treat people with this form of BDD. And then, you know, wow, that's great for the relationship, right? But, we don't treat it by saying, have your girlfriend get a cosmetic procedure, right? We treat it with medication and cognitive behavioral therapy, a form of therapy called cognitive behavioral therapy for BDD. That's the standard treatment, and we can use it for this form of BDD. I've seen parents who obsess about their child's appearance. In one case, a 2-year-old who the mother thought her nose was misshapen, which it wasn't, and wouldn't let any family visit the child, wouldn't take the child out of the apartment because she was so, you know, embarrassed by the child's nose. And the child was a perfectly adorable little girl. So sometimes, this is a less common form of BDD, but can be very problematic.
Look, my thinking goes to sort of where we're heading with it, because if we're growing up in this more perfectionistic world and lifestyle, and the images of each other that we're just altering or we are perfecting over and over again, from what I know from perfectionism, is there's this, and it's the one that I've actually done my research in, which is called other orientated perfectionism, your want for someone else to be perfect. So you see it in teachers, leaders, coaches, that you want someone else to be perfect. But you could see it in relationships as well. "Oh, I wish they would act that way," or "I wish they would do that." And you set a standard for someone else to uphold. But then as we now grow up in a world where parents are more frequently being open to cosmetic surgery, to alterations, and if we say generally that BDD is on the increase, then surely there's going to be a transference to the next generation. And will it get worse? Will it just increase? And is it going to go on the up, and where does it end?
Perhaps. And I think as parents, you have to be so careful, right, not to overemphasize the importance of appearance, and, to emphasize that other things really matter a lot in life, right? That your values, how you treat other people, um, you know, are you doing good in the world? Well, these are some of my own values, right, I suppose. But, we have to be so careful because I think our youth are being bombarded by social media, by everything going on around them that overemphasizes the importance of appearance and emphasizes that perfection, which, is by definition is just really not attainable anyway. And so I think as parents, we have to just be very careful not to, overemphasize perfection. Of course, striving to do well is one thing that's worthwhile, right? But perfection is that who is perfect. So we just had to be kind of aware of our own behavior, especially around kids, and not be overly focused on their appearance, not conveying that appearance is the most important thing. Um, Certainly not telling our kids they should get plastic surgery, right?
Hmm.
Um,
If you enjoyed that clip with Katharine and you want to watch the full episode, all you have to do is click around about here.